started
Yes.
the hospital acquired?
Colonization naman.
Okay. So for like what I've said earlier, when we define these two terms, they actually have difference, okay? So infection is actually the invasion or multiplication of pathogen, okay? Or the microorganism, may it be a virus and a bacteria or parasites or protozoans, okay? So when you have the infection, you already have signs and symptoms already, okay? Like fever, vomiting, nausea. But when you say colonization, okay, your body is colonized or invaded by microorganism, but you are not experiencing any signs and symptoms. There is no effect on your system. They are only there. They are dormant, okay, but they actually don't cause any disease. But the moment, okay, the the immune system of the individual will be compromised or it will be weakened, that's the time they will cause an infection or inflammation, or there will be signs and symptoms that will appear already. Okay, so that's the difference between infection and colonization. So there are two types of infectious diseases. The first is the ones acquired in the community. And the second type will be hospital acquired, or the nosocomial infection. Okay, so when you say community acquired, okay, this is usually you already have the infection or the disease prior to the admission. Okay, and then when you say hospital acquired or the nosocomial infection, after discharge, you start from third day or within 14 days, you are now experiencing signs and symptoms, okay? When you are already at home, that would be considered hospital-acquired nosocomial infection. And there are two sources for this. We have, yes? Yes? Hindi lumipat yung slide? Class, are you with me?
Yes, ma'am.
Yes, ma'am.
Lumipat yung slide. We are now on the two types of infectious or infectious disease, or two types of infection. Are you in the same slide with me?
Yes, ma'am.
Yes, ma'am.
Okay, so there are two sources, like what I've said a while ago. We have the endogenous source, okay? This is acquired, okay, from inside, okay? And then when you say exogenous, this is acquired from outside. So what's the difference between community acquired and hospital acquired infection? Okay, so like what I've said, for the hospital acquired, it is from the third day and or within 14 days from discharge. Okay, so that's why this is the nosocomial infection is very common. If you will not be following guidelines and protocols, this hospital-acquired infection will be possible. Okay, you are done with the other sickness or disease. You are well. Okay, after discharge, you are well with your previous sickness or infection. Now comes, if you are infected with this hospital acquired, you will be having the signs and symptoms from the third day and or within 14 days of discharge. Okay, and then when you say community acquired, this is present or incubating at the time of admission. So prior to admission, you already had the disease. You already had the signs and symptoms, fever, if you have no experiencing nausea, you vomit, okay? So these are the present condition that you have upon admission. So these are the two types of infection. Okay, so these are the following pathogens most involved in nosocomial infection or in hospital acquired. Okay, we have 34% would be the gram-negative positive. Examples are the following. We have the Staphylococcus aureus, Enterococcus species, coagulase negative staphylococci. Don't you worry, because in the finals where we will be emphasizing and discussing more in detail this following microorganism that causes specific diseases. Okay, that also colonizes or target specific systems in our body. Okay, so for the gram-negative, it comprises 32% of this nosocomial infection. We have the Pseudomonas aeruginosa, Enterobacter species, Escherichia coli, and Klebsiella species. Okay, so others, okay, most involved would be our Clostridium difficile. Our Clostridium difficile is our normal microflora or normal microbiota that's in our colon. Okay? But they are only in low amount or lesser number. So the Clostridium difficile or difficile, which is present as a normal microbiota or our normal microflora in our colon, okay, it actually produces two toxins. Okay, we have the first would be enterotoxin. Okay, this enterotoxin, it will not actually cause any diseases if they are in lesser number or in lesser amount. But the moment they will increase in number, they will be able to cause infection or disease. We call the infection or the disease or the sickness is the antibiotic associated disease. Okay. And the second toxin produced by the Clostridium difficile is, or the Clostridium difficile will be cytotoxin, okay, in greater amount also, which produces the Pseudomonas associated disease, okay. This pseudomembranous, I should say, pseudomembranous colitis will actually cause bloody stool, okay, by slashing off linings of the colon. Okay, so there are two, I repeat, toxin that produced by Clostridium difficile. Okay, that would be enterotoxin and cytotoxin. Okay, so the first, okay, I repeat, for enterotoxin, it will cause, okay, antibiotic associated diseases. Okay, for cytotoxin, it would be Pseudomonas, okay, pseudomembranous colitis. Okay, and the Candida albicans, which is usually present in the reproductive tract of female. If you are having a healthy lifestyle, okay, you will be having this, okay, infection caused by Candida albicans. Okay, yung sinasabi nilang vaginitis or bacterial vaginosis or yung thrush. Okay, so for the most common types of infection usually occur, okay, in the hospital, we have the following: urinary tract infection caused by catheterization, use of the catheters, when they will actually extract fluids, okay? And then we have the surgical wound, okay? Improper cleaning or failure to follow guidelines and instructions from the doctors, you will be having this kind of infection. And of course, lower respiratory tract infection. Okay. Later in the succeeding slides, the lower respiratory tract infection is actually easily be transmitted. Okay, it can easily be transferred because if in one, like for example, in the yung Medicare ward na sinasabi nila sa hospital, if there will be mixture or combination of the different diseases or infections there, that includes the lower respiratory tract like pneumonia, TB, it can also affect or infect other patients there. So that's why it's the common type of nosocomial infection. Fourth would be septicemia. So remember that word septicemia. This is now the inflammation or of the blood. Okay, there will be now invasion of the systemic. We call this a systemic infection because it's already in the blood. Okay, or the infection in the blood. We call it the septicemia. So these are the most common types of infection. So why are nosocomial infection emerging? Okay, so these are the reasons. First will be antimicrobial use in hospitals and long-term facilities. So remember, if you will be having, there will be, okay, if you will be taking antibiotics more than what's prescribed, okay, there will be, chances are, this multi-drug, okay, resistance microorganism will be, okay, will be emerging, okay, in the hospital. Second will be failure to follow basic infection control. So when you say failure to follow basic infection control, if you are not following the how to properly dispose your waste, it can be others will be infected, or if you are not wearing your complete PPE, that would be the ways and means to spread the infection. Okay. Third would be patients are becoming increasingly immunocompromised. So their immune system weakens already. So these are the following reasons why nosocomial infections are emerging, okay, or high in the hospital. Okay, so these are the areas where infection is most probable. First, we have the emergency room. So in the emergency room, upon admission, you don't know what's each of the patient or the individual has actually different sickness or diseases. So you don't know if others have TB already, which can be it can be transmitted through airborne or droplets. Okay, that's why emergency room is one of the areas where infection is most probable. When you say most probable, there will be high possibility that can be spread. The spread of the infection will be high in this area, in this area in the hospital. Okay, that would be emergency room. Next would be operating room. Okay, so in the operating room, if the healthcare professionals like the the doctors or the nurses or the staffs present in the operating room will not follow protocols. Like you see the protocols and the guidelines when you watch Korean movies, yung mga Korean series, di ba? The moment they are in the, before they will enter the operating room, they will no longer touch anything, di ba? Mayroon lang silang parang sinisikong ganyan, okay? So they need to follow actually and wear the proper PPE, okay? Because they can cause infection. Whatever is there is present in them will be able to spread in the patient. Okay, or the patient will be able to spread anything from the patient to the healthcare professional or vice versa. So operating room is one of the area where infection is most probable. Okay, third would be delivery room. Okay, so of course um, the reason why delivery room is one of the areas where infection is most probable because the baby is actually very prone to infection. Okay, right? We cannot say that the immune system of baby is that strong because she or he doesn't have any vaccine yet. But of course, that's why the first vaccine that's been injected to the baby is the BCG. Okay, the ones protecting us from TB. Okay, the ones protecting us, okay, to get any airborne microorganism from the environment. So that's why delivery room is one of the areas where infection is most probable. Okay, third will be nursery room. Okay, so common sense will tell you that in the nursery room, okay, there are infants there where they can easily get any infection from the environment. So that's why they need to follow protocols there. Okay. So that's one area where infection is also most probable. Next would be central supply area. Okay. So in the central supply area, the pharmacist in charge or the in charge for the central supply area makes you sure that the supplies there, may it be an IV, an syringe, they need to check its expiry dates, or there are physical changes, or there will be physical destruction on the packaging or whatever. Because infection would be most probable if they will be able to use the supply, those already expired or infected supplies, to their patient. Okay, that's the another way where they can already spread the infection. Okay, so that's the central supply area. Next would be neonatal intensive care unit. So I know you know already what it meant when an individual, may it be a baby or an elderly, okay, or an adult or a children, when they are already in the ICU. So when you say ICU, that would be intensive care unit. This is now the patient where their lives are in danger already. Most especially when you are in the neonatal intensive care unit. Okay? So they need to follow protocols also there. Okay? So this is one area where infection is most probable. Okay? This would be for ICU for the adult or the elderly. Okay? So I also experienced, okay, entering an ICU already. So they are very strict when it comes to to having only one visitor per one visitor entering the unit, and you need to actually wear your complete PPE. But there are times where they are not, the families or any guest will not be allowed to enter the ICU. They are already there outside with the transparent or the glassed window. Okay? From afar, they will be able to see their loved ones. So these are the areas where infection is most probable. Okay? Next would be the patients in the hospital where they are most vulnerable. Okay? When you meant by the word vulnerable, they are the ones easily be infected. Okay, so we have the premature infants and newborns. Okay, so that's why delicate care should be always follow when we cater infants and newborns. Nurses, for you nurses in the future, you know what it meant. Okay, later when you will be having your duties in the community or in the hospital, okay, you will be able to understand what it meant for these following concepts. Okay, so Next would be women in labor and delivery. So they are also most vulnerable patients in the hospital. Okay. Next would be patient receiving steroids. So though these are the patient having diseases like multiple sclerosis, those patient taking steroids because their immune system are compromised. Okay, they can easily be infected with infection or other diseases. Okay. Next, patient receiving anti-cancer drugs. Okay. So they are also most vulnerable patient in hospital because cancer patient actually, aside from their immune system are weak, okay, and they are already immunosuppressed patient, okay, they don't actually have the parang wala silang ganang kumain already. They don't, because when you receive anti-cancer drugs, not only those healthy cells or not only those cancer cells are affected, but also the healthy cells. So that's why one of the signs or the what do you call this, after effect of taking those drugs or the chemotherapy, okay, is of course losing your hair, okay, and of course you don't have any kumbaga panlasa, okay. So these are the most vulnerable patient in hospital, okay. Others are those patient receiving anti-lymphocyte serum, okay. So the examples for this patient receiving anti-lymphocyte serum, these are the patient who undergone, okay, kidney transplant. Okay, so they are also most vulnerable patient in the hospital because they don't know if the organ that's being transplanted to them will be able to work it out with their system. So that's why they are also most vulnerable patient in the hospital. Okay? Kasi after the transplant, okay? If may it be a kidney transplant or whatever it is, they will actually receiving this anti-lymphocyte serum. Okay? Next would be patient receiving radiation. Okay? So same's true with the chemotherapy. Those patients receiving anti-cancer drugs. Are you following, class? Are you with me? Are you
Yes,
still
ma'am.
okay?
Yes, ma'am.
Okay, so good. Patient receiving radiation, okay, it's actually the same, okay, with because they are treating those kinds of cancer, okay, but the only difference is that when you receive anti-cancer drugs or the chemotherapy, okay, it actually, okay, when you take in the medication, okay, it will actually affect your whole system compared when you have the radiation. The only target of this radiation would be the ones affected. Kunyari, meron kang cancer with your the lungs or whatever. It's only that portion or part of your system or your body. Okay? So they are also vulnerable patient in hospital. Others will be surgical patient. Okay? They are also vulnerable because the moment they will not be able to follow, okay, how to maintain or to cleanse their or to follow protocols on how to um, to remove or replace every now and then their yung mga dressings, okay, they will be vulnerable patient in also in the hospital. Okay. Next would be burn patient. Okay. So for this burn patient, of course you will be vulnerable because you will be having open wounds already. So whatever is present in the environment, you can be easily be infected. Okay? So they are also considered most vulnerable patient in the hospital. Others will be diabetic patients. Since if you are diabetic, you have wounds that cannot be it cannot be treated for just for how many days, but it would be long enough. Okay, that's why if you have wounds, okay, if you have gas gangrene and you are diabetic, the most okay appropriate treatment would be kumbaga puputulan ka, debridement. Okay, so they are also most vulnerable patient in the hospital. Others would be cancer patient, okay, most especially for those children, okay, and also AIDS patient. So remember, for this following diseases or infection, their immune system are already weakened or compromised. So that's why they are also considered most vulnerable patient in the hospital. Okay? And of course, those paralyzed patient, okay? They are also vulnerable patient in the hospital because sometimes or most often time, if you are paralyzed, you can no longer um, move your body. But if the healthcare professional in charge, they needs to make sure that you are be moving side by side to prevent from having any respiratory or pneumonia like symptoms. Kasi minsan imbes na uh, the current situation will be the cause of the death, it will be sometimes the cause of the death would be the the, um, the pneumonia already. Kasi nakahiga sila for the whole time. Okay? So they are also considered most vulnerable patient in the hospital. So for the major contributing factors of these nosocomial infections, we have the following. Okay? So we have the drug resistance pathogens. So remember, okay, there are already multi drug resistance pathogen that are very, very difficult to kill or destroy. So they are also one contributing factor. Okay. Next would be failure to follow guidelines. Sometimes these are the most common reasons why nosocomial infections are emerging. Failure to follow guidelines. Third would be immunocompromised patient. Okay. Sometimes this most common cause will be also the cause of deaths of patient. Okay, kasi medyo mahina na sila, most especially for the elderly. Okay, so this also is one of the contributing factor of the nosocomial infection. Next would be indiscriminate use of antimicrobial agents. When you say indiscriminate use of antimicrobial agents, if you will not be following the prescription, okay, of the doctors, instead of taking the antibiotic 7 days and you stop it at exactly 5 days, you stop already taking it. So there would be a big effect on your on the treatment that's supposed to be. You need to finish the whole term of the antibiotic for 7 days. Okay. Next, false sense of security. Okay? So in the hospital sometimes, 'di ba, there are families or there are members of the families that they might also suspect the security of their loved ones in a certain hospital. So that's why a lot of patient and family members still go to the private hospital, okay, even if it's expensive, okay, because they need to make sure that the patient will be safe and secure whenever possible. Okay. Next would be lengthy, more complicated surgery would be also one of the major contributing factors. Okay, so if it's lengthy, there will be there will be possibilities of the infection. Okay, kung medyo mas matagal ang surgery. Kasi syempre, if there will be lengthy or long, okay, time for the surgery, okay, there will be possibilities of infections already. Okay. Next would be overcrowding. So we experienced that before when there is actually we already have an outbreak of dengue here, I think, in Tuguegarao in previous years. Okay, so one of the major contributing factor is overcrowding. Okay, if other patient will also be, like for example, um, not only for the dengue outbreak before, but this in time of pandemic, they already make crowd outside the hospital, di ba? Wala nang mapaglagyan. So, this is actually a major contributing factor. If they will be only be lying in the hallway or others outside, they only be placing tents there. So other healthcare professionals will also can be have the possibilities of being infected with the COVID-19 disease or other diseases. Okay. Next would be less highly trained personnel. Okay. So if you observe, okay, there are private hospitals or private institutions, okay, where they have very young, okay, nurse staff compared it when you go to CBMC, most of them are tenured already. Okay, this is because when you are in the private hospital, of course, the salary is lower than when you are in the government. So that's why others, they will just spend, okay, two years in the private institution to have mastery or gain experience, but after some time they will, okay, transfer in a government hospital, or most of them will go abroad. So that's why if they will have less highly trained personnel, they can be a cause of the spread of the infection. They can be a contributing factor of the spread of the infection. Kasi minsan nagkakamali sila, okay, if they are less trained, okay, they can induce iatrogenic infection, okay, or if the physician is of course it's not that trained enough to perform the procedure, it can induce iatrogenic infection. That is the one that is simply termed as physician-induced infection, the improper performed procedure by the healthcare professionals. Other is overuse and improper use of indwelling devices. This is actually same with if the healthcare professional are not trained, so there can be a contributing factor of the UTI if you don't know how to use actually catheter, okay, perform catheterization. It can lead to an infection to the patient that would be urinary tract infection. Okay, so for the infection control, okay, we have the following procedures, and these are the following contributors to infection control procedures. First, we have Florence Nightingale. Okay, she is actually called and usually commonly called the lady with the lamp. Okay, she was the first to introduce the environmental theory, and she contributed a lot to the Crimean War. So Florence Nightingale, she was the first to introduce procedural methods, okay, guidelines, protocols in the hospital. Okay, So she is also a nurse. Okay, that's Florence Nightingale. Okay, Joseph Lister, if you still remember, okay, he actually he was the first to institute the use of phenol, the very first chemical agent used to disinfect, okay, the utensils or what or disinfect rooms in the hospital. Okay, use of also of phenol mist is actually also introduced steam sterilization, use of surgical masks, gloves and gowns or the PPE, and use the sterile drape and sponge usually used when they in the surgical room. Okay, so that's Joseph Lister. Ignaz Semmelweis is actually he is actually the father of hand washing, hand disinfection, and of course father of hospital epidemiology because of his contribution to the infection control procedure. He actually instituted the use of chlorinated lime in the hospital, okay, to control the infection. So these are the infection control procedures. Okay, so we have of course the aseptic technique. Okay, the standard precaution which is applies to all patient, and of course the transmission based precaution and the isolation technique. Okay, so in each will be discussed in the following, in the succeeding slides. Okay, so we need first, okay, again to differentiate and define the following terms. Okay, so we have the term medical asepsis or the clean technique. Okay, so this involves procedures and practices that reduces the number and transmission of pathogens. So the goal is the exclusion of all pathogens, not all microorganisms. That's medical asepsis or clean technique. Okay, so this includes frequent and thoroughly hand washing, proper cleaning of supplies and equipment, okay, or disinfection of the rooms, okay, or the hallway, the floor, the walls, okay, proper disposal of needles, okay, contaminated materials, and infectious waste. So this is the proper segregation of waste. That is the medical asepsis or the clean technique. Okay, so we have the following. Okay, um, we have the following different or separate trash bins for each of the following waste. So if you will be able to see, okay, trash bins with the color codes of black. Okay, so the trash bin has, like for example, it has a black, okay, color of the waste bin. That would be for dry non-infectious waste. Okay, for green, that would be wet non-infectious waste. Okay, for yellow, that would be infectious and pathological waste. So when you say infection is and pathological waste, that would be the waste from disease carcasses or organs. Okay, and of course for chemical waste, it would be yellow with a combination of a black color. That would be for chemical waste and heavy metals used in other treatments like radiation. Okay, and then I'm for the radioactive waste. This is actually I stand corrected. Okay, this is actually different from the chemical waste or the heavy metals used from other treatments. Okay, for the radioactive waste, this is solely for the ones from the radiation treatment. Okay, so we have the orange color. Okay, for the sharps, usually red. Okay, so in each of the color codes, it has separate waste bin. Okay, so they cannot be mixed or combined together. Okay, for surgical asepsis or sterile technique, this includes practices used to render and keep objects and areas sterile. So the goal of this is exclusion of all microorganisms. May it be those pathogenic ones and non-pathogenic ones. Okay? So these are the areas where surgical asepsis or sterile technique is practice, we have the operating room, labor and delivery room, and of course, special diagnostic areas. Okay. So, for the principles and practices when you perform surgical or sterile technique, all objects used in the sterile field must be sterile. So, lahat. So, every after patient use, they will be disinfecting the walls, the floor, everything. All the equipments, all the surgical instrument like scalpel, scissors, or the sponges, or the drapes should be sterile. Okay? Another will be sterile objects become unsterile when touched by unsterile objects. So that's why they need to, okay, replace, okay, or remove their gloves every after patient. Okay? And then sterile items that are out of vision or below the waist level of the nurse are considered unsterile. So all the instrument should be on the vision, eye level. Okay? Other than that, it would be considered unsterile. So ganun sila ka-strict when they are in the labor room, in the surgical room. Okay? So they need to follow these principles and practices or these protocols or guidelines. Okay? So sterile objects can become unsterile by prolonged exposure to airborne microorganism. So the moment you will only be, okay, getting the sterile objects or instrument if you need it already. Because prolonged exposure would be considered unsterile already because of the airborne microorganism that might be present in the room. Okay? Another would be fluids flow in the direction of the gravity. So they needs to follow the direction of gravity when they insert or they be inserting the IV or the dextrose or whatever. Okay, so another would be the edges of the sterile field are considered unsterile. Okay, so when they are in the room, okay, edges of the sterile field are considered unsterile. Okay, and the skin cannot be sterilized and is unsterile. So that's why they need to use the antiseptic. Okay, they cannot disinfect it, they cannot sterilize using the autoclave. So that's why they need to apply antiseptics or the povidone iodine or the betadine. Okay, and then honesty is an essential quality in maintaining surgical asepsis. So the healthcare professionals or you, nurses in the future, you need to be very honest at all times. Okay, honest in the sense that you need to follow protocols for the patient not to be infected or you not to be infected with the infection present in the patient. So, honesty is essential quality in maintaining surgical asepsis. Yung sinabi mo, are you done washing your hands? Yes, but you did not actually perform it. So, that's dishonesty. Even if they will not be your head or the head of the nurse or the doctors I will not be seeing you doing those things, you are in yourself, you needs to be honest enough to follow protocols. Okay? So that's some of the principles and the practices that you need to follow when you are working already in the hospital. Okay? For the standard precautions, these are the precautions used for the care of all hospitalized patients, regardless of their diagnosis or presumed infection status. Okay? This is based on the 1996 CDC. Okay? Blood and all body fluids, secretions and excretion except sweat, regardless of whether they contain vesical blood, non-intact skin, and mucous membrane. Okay? So, in the standard precaution, you need to follow the following precaution. hand washing, okay? You need to perform that, okay? And then you need to use alcohol-based hand rubs and have the complete personal protective equipment. That is, of course, use of the hairnet, okay, face mask, shoe cover, the lab gowns, the gloves, okay, and sometimes, of course, the eye protector, because you don't know if there will be splashes of the blood when you are catering or attending to one patient. So this is to prevent also the healthcare professionals to be infected, whatever is the disease of a certain patient. Okay? So these are the following personal protective equipment. Okay? Okay. So this is just a representation of the complete personal equipment, protective equipment. Okay? So these are the guidelines on the use of gloves that you need to follow every now and then, okay? When you are already working, or if you are to have duty hours already in the hospital, so warn when there is the gloves. We are talking here with the use of the gloves. Anticipated contact with moist body substances, mucous membrane, tissue, and non-intact skin of all patient. Okay? And then contact with surfaces and articles visibly soiled, contaminated by body substances. Okay? And then when you are to perform venipuncture or other muscular access procedure, you know already the reason why, because if the patient has AIDS or HIV, okay, and you have open wounds, kahit konti lang, if you have cuts or abrasions and you did not wear any gloves, it might be the way of the entrance of the pathogen or the microorganism. Handling of specimen when contamination of N is anticipated. When you are handling stools, urine, blood, pus, okay, whatever it is, any clinical specimen, you need to wear your gloves, okay? And should change gloves between task and between client contact. Remember the our chain of infection, okay? It will be a cause on infection to the next patient if you will not be changing your gloves every after patient use, okay? And of course, you need to do hand washing after removing your gloves, okay? Because it might be that there will be, okay, a possibility that can be the gloves have meron pa ring pores that can be a cause that of a penetration to your skin, or if you have cuts or abrasions, okay? And then do not provide protection. Gloves do not provide protection from needle sticks or other puncture wounds, okay? So that's why if you are sensitive enough, because of course gloves can be penetrated by syringe, pwede ka pa ring ma-infect, you can be pricked, okay? So the only solution is that we need to segregate our waste, okay? You need to dispose syringes and other needles in the appropriate trash bin. That would be the waste bin, which is colored red in the hospital, okay? Guidelines on the use of other PPEs would be the mask, eye protection, and face shield. So worn in combination, used during procedures that are likely to generate droplets, spray, or splash of body substances. Okay? So when you do this following, emptying bedpans, yung code blue. When you have code blue, I think this is the when there will be emergency on that you need to attend on the patient, okay? You need to wear this following PPE. And of course, when the patient cough with infectious etiology, may it be the patient have TB or whatever is the respiratory tract infection or the disease, okay? Next would be non-needle resheathing or recapping. So needles should be solely used, okay? that would be for individual use. You are not to use for, like for example, if you are to have your vaccine, it would be solely for you. Okay, so if you have already these things, okay, you can correct the healthcare professional or the nurse or the doctors if they will be able to use needle from one patient to another. Okay, you can correct them. Okay, so these are the standard precaution, and we need to use puncture resistant containers. Okay, so these are just some examples of the puncture resistant. They are colored red. Okay, and then we have patient care equipment. Okay, so you are to not to perform this. Okay, if you are not like in emergency cases, yung mga nalulunod, but in the hospital you cannot do like this because you are not sure if the patient has TB or whatever is the respiratory infection. Okay, so you need to actually use the proper equipment. Okay, and then you need to follow appropriate patient placement. So when you say follow the appropriate patient placement, okay, so in the hospital, they are not to mix or combine patient with TB with other infection. They can only be mixed or combined together if they have the same, okay, if they have the same disease or infection. Okay, so we have the protective, okay, the protective or the source isolation. First, the source isolation, okay. So the source isolation room is where if the patient has TB or any respiratory tract infection, okay, that can easily be transmitted from one patient to another. So they can be placed in the source isolation room. This room is under negative pressure. So the air from the hallway enters the patient room and can be filtered through the HEPA filters. So the pathogens can be removed using the HEPA filter. Okay. So the protective or the reverse, or we term it the neutropenic isolation, okay, this is the room or where the patient, like the burn patient, those immunocompromised patient, okay, um those cancer patient, okay, are to be in this isolation room, protective isolation room. So the room is under positive pressure. Okay, so the air from the patient rooms enters the hallway. So the air is from the room of the patient and then out to it enters the hallway. Okay, so that's why it is called the reverse isolation room or the protective or neutropenic isolation. So I hope you understood the difference between the source isolation from the protective or the neutropenic isolation. Okay, for the guidelines for the reverse isolation, okay, so this is the difference between the source and protective isolation room. Okay, so for the room pressure, for the source, we have the negative. For the positive, for the protective, we have the positive room pressure. Okay, so the protected person in the source isolation room is other patients. Since if in the source isolation, the patient they might, or the patient may have TB or other respiratory tract disease. Okay, and then for the protective isolation room, the protected person is the patient itself. Okay, movement as to the movement of the air for the source, okay, isolation, air from the room does not go out. Okay, it will be filtered from the HEPA or the HEPA filter, the pathogen will be removed actually in the HEPA filter. Okay. For the protective, the air from the room goes out. Okay. So that's the difference between the source and protective isolation room. Okay. For the transmission-based precaution, we have the following. You still remember the airborne, okay, which can be in the air or the air current because they can have 5 micrometer or less air, but in the droplet they can be greater. Okay, so in the airborne they can be have a long exposure to the air. Okay, compared to the droplet, okay, which is they have be in of greater than the 5 micrometer, they can be only in a lesser time in the air. Okay, so the airborne and the droplet can be transmitted, okay, through, of course, the different diseases from the respiratory tract. TB, okay, pneumonia, those who can have the possibility or transferred mucus or whatever when they cough, okay, or sneeze, okay. And third will be the contact precaution. It can be the direct or indirect precaution. Examples of the diseases that can be transmitted through this is, if you can still remember, is the if you have skin diseases like Bacillella, chickenpox. Okay, so what are the precautions when it when it when we when we talk about transmission-based precaution? Okay, so we have the following for the airborne. Okay, we have if the patient have Bacillella, Rubella, and TB, the placement would be private room unless unavailable. Okay, and then they need to use the N95 respirator. Okay, and then for transport, limited to essential purposes. Okay, place a surgical mask on the patient. So these are the following precautions, guidelines, and practices that you need to follow. Okay. Next would be pneumonia. So this is the example of the N95, okay, mask or face mask or respirator. For the droplet, it can be pneumonia, meningitis, and influenza. They can also be in the private room unless unavailable. Okay. So they need to, they can have the face mask, okay, for the transport, limited to essential purposes. Okay, also place a surgical mask on the patient. Okay, for the contact precaution, these are the following with patient with discharges or secretions. Okay, so their placement would be private room unless unavailable. Okay, PPE would be gloves and gown. Transport limited to essential purposes. Okay, it needs to maintain precautions. Okay, for the transmission-based precautions, this would be the additional guidelines and protocols. Okay, susceptible people should not enter the room of a client who has rubella or Bacillella. If they must enter, they should wear a respirator. Okay, limit movement of client outside the room to essential purposes. Place a surgical mask on the client during transport. Okay, and then place client in private room. So in a private room is not available, place client with another client who is infected with the same microorganism. So this is the one that I'm mentioning a while ago. If they are, if the hospital don't have any more a private room, okay, you can be combined or mixed together, provided you have the same infection or disease. And then for the droplet, okay, wear a mask if working within 3 feet of the client. So may I remind you, my dear students, to follow and master these guidelines, because this will be provided in all the exams, maybe the quizzes and of course the midterm exam. Wear a face mask if working within 3 feet of client. So 3 feet, okay, of client. Okay. Limit movement of client outside the room to essential purposes. Place a surgical mask on client during transport. Okay. And then place client in private room. So it's the same with the droplet and airborne. If the private room is not available, you can place the client with another client who is infected with the same microorganism. Okay. And then wear gloves as described in the standard precautions. You still remember what should be done and what should we do and what should we perform when we wear the gloves. Okay. Change gloves after contact with infectious materials. Okay. Remove gloves before leaving client's room. Wash hands. Okay. Immediately after removing gloves, use an antimicrobial agent. So sometimes or most often times, those practices, okay, those guidelines is pare-pareho lang. When it comes to contact precaution, when it in droplet and airborne precaution. Okay? And then after washing, do not touch possibly contaminated surfaces or items in the room. So that's why if you notice in Korean series, okay, they usually touch it with their yung sa siko nila, okay, or they usually touch to open the room with their foot, okay. So to prevent touching other surfaces when you already hand wash, you are done hand washing, okay, with the hand washing technique, okay. And then limit movement of client outside the room, okay. Dedicate the use of non-critical client care equipment to single client or to clients with same infecting microorganism. Okay, so I hope you are following, class. Are you still with me, class?
Yes
Yes,
po,
We are
ma'am.
okay. We are about to finish this chapter or this module. Okay, so for the special contact precautions, especially when you are dealing with vancomycin resistant infection, use of antimicrobial soap for hand washing is advised. Okay. And then no sharing of equipment among client with or without VRE. Okay. And then isolation should continue until at least 3 cultures taken 1 week apart if the results are already negative. Okay, so you need to be reminded of this following precautions with this special contact precautions. Okay, 3 cultures isolation should continue until at least 3 cultures taken 1 week apart, which is the result would be negative. Okay, so that's it for um, the preventing spread of infectious diseases. Any question, class, regarding the discussion? So, wow, it's already 7:26. So, it's good we finish it on time. Are there any question before we end our meeting? Any question, class? Thank you for those who are opening their camera. I know those students who usually and always following my instruction to open their camera. I always see to is that I would always be mastering your faces or your names. Okay? Any question, class, regarding these are all part of your class standing, following instructions from your instructor or your teachers would be part of your class standing. Okay? Actually, I am done. We are done entering your grades or your scores in the grading sheet. What we are what we are actually waiting for is your scores from the lobster. Okay, and hope based on my based on the what we had, okay, I am hoping that everybody will be making it to 85. Okay? Matataas naman ang inyong mga quizzes, okay? And of course, your midterm exam, may it be a lecture and the lab, okay? So may hila naman siguro ng inyong lobster simulations, okay? Whenever if you are very low or you got very low in the OSPE, we are hoping that everybody will be making it on the 85 in the prelim. Not only in the prelim, but hoping, monitoring your progress and improvement, it would be possible, can be possibly that you will be making also in the midterms and finals. Hoping and praying for that. Okay, any question, class, before we end the meeting? And I repeat, your quiz on Wednesday will not include this one kasi masyado nang madami. Okay? So, the coverage for your quiz on Wednesday would be epidemiology and diagnosis of infectious diseases. This one would be allotted next week. Okay? So, I hope and I'm very thankful because every time we have this adjustment of the schedule, you are always willing to also respond. Okay, instead of not having classes, we always make sure to find any means to meet. Okay, if there are webinars that we need to that I need also to attend to na nataon na nandun sa schedule nyo, so we will find other means. Okay? So I would like to thank everyone for responding for this meeting, especially my BS1F kasi wala silang schedule for tonight. But of course, in lieu of the Wednesday, after the quiz, you are free already. I will update you if you are to required to attend also the webinar that I hope to attend on Wednesday. I will update your class until tomorrow. But if ever you are not required to attend, you are free after the quiz in lieu of our meeting for tonight. Okay? So I will just be seeing you, everybody, next week for the quiz. So if it's okay with you, okay, we will have the quiz next week for the preventing the spread of infectious diseases on, again, we will decide if it's okay with you either Monday or Wednesday because I will need to assign it as one so that there will be no leakage of the quiz. Okay? So please update me for our representative from 1F, Mr. Agatep and Miss Del Castillo, if you will be possibly have a common schedule. Okay? Because it's very difficult for me. I hope you don't mind. Very difficult for making again another set. And it is not only this subject is I'm also have preparations with. Okay, I hope you don't mind. Okay, so any question, class, regarding our discussion this or today or tonight? I hope you learned something from our concepts or topics tonight. So I will be uploading the PowerPoint for tonight after our meeting. Also, I will be for your asynchronous, since I will not be meeting you for your synchronous activities on Wednesday anymore for my 1F, and for my 1G, I will not be anymore meeting you for our Thursday class. This would be for your asynchronous that will be assigned, okay? That would be assigned only on Wednesday and Thursday. Okay? Wednesday for my 1F, Thursday would be for my 1G. Okay? For your asynchronous. Maybe 15 to 30 minutes or wala pa siguro. We will be able to submit it for within 30 minutes. Okay? That would be for Wednesday for my 1F and then Thursday for my 1G. I will just be assigned at 6 o'clock for my 1G, and then I will just be assigning the post-lecture activity for my 1F at 1 o'clock. Okay? So I repeat, your quiz would be at 12 o'clock. You just be ready at 12 o'clock. But of course, it will not be for 1 hour. Maybe the quiz will be 30 minutes for 45 minutes, but we need to prepare at exactly 12 o'clock so that everybody will be already be there in the meeting at 12 o'clock. Okay? So thank you class for attending our meeting today. I could not thank you enough for your all your understanding and for extending all your cooperation with the schedule adjustment. Okay, thank you class for attending, and I'll see you next week. Okay, let's have the closing prayer. Who is our prayer leader for our closing? My BS Bio students also. Before I will forget, I would like to thank also my BS Bio students. Muntik ko na silang nakalimutan. Okay? Who is our prayer leader a while ago? Okay, anak.
Ako po.
Okay, anak. Mr. Kamayan.
So, classmates, let us pray. In the name of the Father, and of the Son, of the Holy Spirit. Amen. Thank you for giving us the opportunity to learn and the capacity to understand. Let our knowledge be of service not only for the attainment of our goals, but also for the benefit of others. Amen. In the name of the Father, and of the Son, of the Holy Spirit. Amen.
Okay, I would like also to thank those who attended the application of the lecturio. Actually, we are advised to use the lecturio. So what we are about to do for the to master the use of the lecturio. So I will be announcing the class if we are now ready to use it. Hindi mo naman basta-bastang magamit yun nang hindi mo man lang ma-master, di ba? Medyo it's actually good also because they have evidence-based information. Okay, they have a broad services. So we might as well maximize the use of the lecturio also. But we cannot actually compromise to use this week because hindi pa naman alam kung paano talaga gawin. Most especially us, okay? But for the meantime, as we go through mastering and learning about the lecturio, maybe before the end of the midterms and on finals, we will be able to use it already. Okay, hopefully, so that we can also experience using other LMS or other means to have a better understanding of the concept of our subject. Okay, so for those who attended, thank you and congratulations. For those who missed to failed to attend, okay, if ever we will be having again training, we will update you. Okay, so thank you class. Stay safe and healthy. Good night and goodbye. Thank you. Bye bye.
Thank
I'll
you,
see you next
ma'am.
week. Okay.
Bye,
Bye,
ma'am.
ma'am.
Goodbye.
Thank you
Thank
po.
you. Bye
Bye,
bye.
ma'am.
Good
Bye,
night.
ma'am.
Okay. Good night. Bye.
Thank you.
Bye, ma'am.
Okay.
Bye, ma'am.
Thank you.
Bye, ma'am.
Bye.
Bye,
Good
ma'am.
night,
Bye,
ma'am.
ma'am.
Bye-bye.
Okay. Bye bye. Sige.
Bye, ma'am.
Bye. Thank you po.
Keep well.
Bye,
Okay.
ma'am.
Bye. Sige.
Bye, ma'am. Thank you.
Sige. Bye. I will now upload the PowerPoint. The assigned task will be only uploaded on Wednesday and Thursday. for 1F and 1G. Okay, thank you. Bye-bye.
Bye, ma'am.
Okay, bye. Good night. Sige. Miss Pascuña, bye-bye.
Bye, ma'am.
Bye, ma'am.
Miss Garunay, bye-bye. Miss
Bye,
Biru,
ma'am.
bye-bye.
Bye, ma'am.
Okay, bye-bye. See you next week. Bye, Adolf.
Goodbye, ma'am. See you, ma'am.
Sige, bye-bye. See you next week. I will now upload the PowerPoint.